I went to medical school in Sheffield, and I then came back down to London and did all my junior doctor jobs in and around London, did some research in London, and then I did my registrar training at both the Royal London and then also at the Royal National Orthopaedic Hospital in Stanmore, and then I did a fellowship, and then I've been a consultant now for about 5 years. But I purely do spinal surgery. I don't do any normal orthopaedics now. I'll see people generally with wear and tear, mainly in their neck and their lower back. I will also do some spinal tumour work and some spinal infection work and disc prolapses, so people who have sciatica or who've got a disc prolapse in their neck and get the equivalent of sciatica but in their arm. The range of treatments there goes from initially trying to sort of encourage them to look at their own life and how they're seated and encourage them to have physiotherapy, and then it extends to things like injections and surgery.
It started off, it felt like I was having a trapped nerve in the neck, and I was continually getting shock shooting down the arm, which was uncontrollable, and quite a lot of pain. Eventually I went to the GP and said, look, this isn't getting better. And they had recommended I go and see a consultant, and I met the consultant, and I had must have been about 6 months treatment of anti-inflammatory tablets and antibiotics, and I could feel that because this wasn't getting better, I needed to see somebody of a higher level of consultancy. I actually met Adam in the hospital in Guildford just for the first consultancy. And then we fixed the time and said we would come in and do the operation here. On the day of admission, you come in early in the morning, and that was very well handled. Nurses seemed very kind, and they take you to your room and make you feel comfortable and settle you down before you go in for the operation.
By coming to Clare Park, they're absolutely guaranteed to see me and have a consultation with me. We will talk about their initial problems, and then often I will be organising an MRI scan, and I'll then sit here with them during the consultation and show them their scan. We'll talk about the various treatment options, and I'll talk about how severe their symptoms are as to the kind of benefit or the level of risk an operation may be. And then from a procedure point of view, it's the concentrated nursing and rehabilitation physio that patients really benefit from.
I thought the whole thing was great. I can remember waking up from the operation and the pain had gone. And I expected to have a lot of pain from the operation. I had nothing. I then met with Dr. Wake. He came in and checked me over to make sure that everything was okay. And then I had another examination on the following day, and I was allowed to leave. He said basically 100% perfect operation. Really didn't need to see me again. I've got quality services, quality building, excellent surgery facilities and aftercare.